So let's talk anaphylaxis. Now, you've probably heard of this before. Maybe you know someone with severe allergies or you have them yourself. Anaphylaxis is much more than just a simple allergic reaction. So let's look at it closer and let's hit the highlights. Now, like I said, anaphylaxis is not just any old allergy or allergic reaction. This is a severe, extreme allergic reaction with rapid onset. It usually results in a massive histamine release, and it obviously can be life-threatening. So remember, the purpose of histamine is it responds to an allergen. So when I have contact with something I'm allergic to, I get this strong histamine release. This could be something like any kind of food, could be a medication allergy, or things like peanuts, bee stings, or even latex, which is one we always have to be cognizant of in the hospital. And so this histamine gets released and it causes an inflammatory response, and it causes swelling. And that's just part of what histamine does. The difference here is that it's a huge release of histamine. And so then this swelling is everywhere. You can see it's around his eyes. You can see his cheeks are starting to swell. And it can be in the mouth, in the throat. And so it really can be life-threatening if untreated. So what specifically are we going to see in our patients? Where we will see urticaria, otherwise known as hives. And that's like what you see here, these raised red bumps, and they're usually very itchy. And this could be anywhere on the body because this is a systemic response. It's throughout the whole body. The second thing we see, and the reason this can be so life-threatening, is the angioedema. Angioedema is swelling of the face, lips, tongue, and throat. So if you hear someone say their throat closed up, this is what they're talking about. So you can see here how this man's tongue, the side of it, is severely swollen on one side. So the problem with this swelling in the mouth is obviously that it can compromise their airway. And so we're very concerned about addressing the situation. You may see swelling in the airway, and you could even hear things that sound similar to asthma, like wheezing or stridor. We're also going to see skin flushing because histamine releases chemicals that cause massive vasodilation. Now, if you watched the shock module in the cardiac course, specifically the distributive shock module, we talked a lot about how this massive peripheral vasodilation can cause distributive shock. So anaphylaxis can actually lead to anaphylactic shock as well. So these patients are at severe risk for hypotension and even cardiac arrest if we don't treat the situation quickly. So what are we going to do? Now, of course, we'd always like to prevent the response in the first place. So we always want to assess for allergies. In the outpatient setting, we can do something called a patch test. Now, what they'll do is they'll expose the skin to, about 40 or so known allergens. They'll cover it. They'll come back in 24 hours, and they'll see which one of these things have developed redness or hives, and they know that's a confirmed allergy. In the hospital, the best way to confirm allergies is to ask your patient what they are allergic to. And I always ask them any foods, any medications, any other substances. We always want to make sure we know if they have medication allergies and know if they have a latex allergy. That is a big one. Now, most of our equipment in the hospital is latex free nowadays, but you always want to triple check. And another thing to note is if you're giving someone a medication they have never had before, they may be allergic to it and just not know it. For me personally, when my doctors ask me if I have any allergies, my answer is always not yet because I haven't had every medication and I don't take a lot of medication. Now, if your patient does develop anaphylaxis, or maybe they come into the ER with signs of anaphylaxis, we definitely want to get them on a monitor. We want to monitor their respiratory and their cardiovascular status. Monitor for signs of cardiovascular collapse. We know this can be life-threatening. Now, there is some NCLEX controversy around whether to give epi or oxygen first. The NCLEX answer is to apply oxygen, especially considering maybe your unit doesn't have EpiPens stocked, they don't have epinephrine available. It might take a few minutes to get it. So just keep this in mind though, because this is from us. So NCLEX says oxygen first. If your patient's airway is closed, how are they going to get the oxygen in? Just think about that for a sec. If you have a closed up airway and I give you oxygen, is it doing you any good? No, right? So in the real world, be thinking about those things. Don't delay epinephrine to apply oxygen. If you have the epi on hand, give it right away. If you don't, send somebody to get it or have somebody put oxygen on your patient while you go get it. You can do things at the same time, but don't delay epi for the sake of oxygen, because if your airway's closed, it's not doing you any good. Okay. So there's some real world stuff there for you guys. Now, like I said, usually we use these EpiPen auto injectors and we give it intramuscularly. You literally take off the cap and you jab it into their leg or into their arm, usually into their thigh. That's the best place to do it. Now, keep in mind, this is a different epi than we give during a code. This epinephrine is 1 in 1,000, and in a code blue, it's going to be 1 in 10,000. So please don't mix these up. The epinephrine for anaphylaxis is a different concentration. So why do we give epinephrine? Well, it stimulates our sympathetic nervous system. Sympathetic nervous system is our fight or flight response. So it's going to bronchodilate. It's going to open up the airways. It's going to vasoconstrict to prevent shock. Remember, we said there's all this massive vasodilation because of the histamine response. So we want to give them that vasoconstriction to prevent that cardiovascular collapse. Okay. Now, then we're also going to give antihistamines because we want to stop the histamine response. This could be something like diphenhydramine. We're going to give corticosteroids to decrease the swelling and inflammation. We're going to give IV fluids to support their hemodynamics. And of course, keep in mind, they may end up needing some sort of airway protection with an artificial airway like an ET tube, or in really severe cases, a tracheotomy. So these patients are going to need to be in the ICU until we're sure that they're out of the woods and they're not going to go into cardiac or respiratory failure. All right. Top priority nursing concepts for a patient with anaphylaxis. Immunity. We want to stop that immune response. That's the epinephrine. That's the antihistamines. Stop that allergic response so that it stops causing problems. Oxygenation. We want to make sure they have a patent airway, that they're getting the oxygen that they need, that they're able to breathe. And perfusion, because we know they're at risk for anaphylactic shock. We want to monitor their blood pressure and keep an eye on their hemodynamics and their vital signs. So, quick recap, anaphylaxis is a severe, extreme allergic reaction, causes massive histamine release that causes inflammation and vasodilation that'll lead to urticaria or hives, possible angioedema, especially in the face and the throat, and skin flushing. These things will put the patient's airway at risk, and so we want to treat as soon as possible because we know it's a life-threatening scenario. Monitor hemodynamics because they are at risk for anaphylactic shock. We want to make sure we're always assessing our patients for allergies. The last thing we want to do is not pay attention and not ask and find out they were actually allergic to penicillin all the time, and we gave it to them anyways. Outpatient, they'll do a patch test, but in the hospital, just ask. Ask the patient if they've ever had an allergic reaction. All allergies, meds, food, and especially latex. Now, if your patient does develop anaphylaxis, you're going to treat immediately with O2, epinephrine, antihistamines, and steroids. And of course, we can also give IV fluids to support their hemodynamics, keep that blood pressure up, and keep this from compromising their whole cardiovascular system. So those are the basics for anaphylaxis. Make sure you check out all of the resources attached to this lesson to learn more about how to care for these patients, and make sure you look into the differences between epinephrine for a code and epinephrine for anaphylaxis. Check that out in the pharmacology lesson. All right, guys, go out and be your best selves today. And as always, happy nursing.